our next speaker for the day, Dr. Rajesh Balkrishnan, who is a PhD holder and currently a professor at the University of Virginia School of Medicine. He is an internationally renowned public health scientist. His teaching and research experience focuses on analyzing large data repositories, developing registries for non communicable diseases, and conducting health and epidemiology research related to global medical care access. He's an effective teacher, a research mentor, and has also served as a consultant even for the WHO. Sir, we're very grateful to have you on this on our board with us. I know it's late for you there, but despite that, you have chosen to take time out to enlighten us with your wisdom, sir. Over to you.
Thank you so much. It's a real pleasure to be able to see all of you virtually. I have visited the NETI campus a couple of times in the past and very impressed with the programs in place and all the developments that are taking place on the campus. And of course, you have very young and dynamic faculty members like Dr. Maleti who are working very hard in spite of these trying circumstances to organize these type of workshops and things like that. I totally empathize with all of you. Next semester, I teach 2 classes online, and this is not the preferred way we like to kind of teach things. But unfortunately, we this whole thing, this whole COVID fiasco in the world has shown us how fragile our systems in place are for everything in life right now. We might think that we have perfected medicine from an art to a science, and we have sort of the answers for everything. But here comes along something like this, a virus, and completely displaces our life in a matter of days. So I think it's really nice in the long run to have all these discussions about health economics and outcomes research and all these fun things. But I think this larger public health pandemic has put a lot of these issues in context for us, for us to think about what are the type of skills and what we sort of need to do to sort of be able to be professionally successful in this current work scenario. I mean, of course, given this pandemic, a lot of places have moved to asking employees to work from home. Like I personally am not allowed to go in and teach. The students are not allowed to come in. So we have to try to get as many things done online. So there are obviously some advantages of this. You can learn at your own pace. You sort of move towards a very cost effective system of learning, whereby you can just use technology and basically be able to sort of enlighten yourself. This is what we've been moving towards before, but there still are things that we sort of need to do, and systems that are disrupted that we sort of need to address. I mean, we talk about all this comparative effectiveness and health outcomes research and things like that. And the backbone for a lot of that is sort of our dependence on large informatics systems. And yes, we have the technology now to do all these systems and so on and so forth. But at the backbone of this, our goal in the end is to improve patient-centered care. And we want the best for the patients. That's why you are getting a professional healthcare degree. The previous speaker spoke a lot about how things are in Canada and what it sort of takes to become a retail pharmacist in Canada. And one good thing in Canada compared to the US, for example, is that I
Sir,
think
I'll
that you're
just interrupt you for a second. So,
sure.
just reminding you if you have a slideshow to share, sir, You could
No, I
share
don't
it.
have any slides.
No slides. Okay, sir.
I don't have
Continue.
any slides. I really don't have any slides. My goal in this talk was not to sort of give you any slides. I think Dr. Bhattacharjee and several other speakers have already kind of given you that. What my goal in this talk, right up front, is to sort of kind of give you some practical advice about how you sort of need to prepare yourself. I can throw 100 slides over here at you right now, but none of those are going to be useful in the long run. So I'd urge you to sort of pay some attention to some of these words that I'm talking about, because I think this is really important. We live in an era of great uncertainty. We don't even know. I mean, if things become worse with the pandemic, and of course everybody is so confident that these vaccines are going to work and everything is going to be fine, but the truth of the matter remains that I was just reading the other day. I was in India just last week, and there were many editorials out that some of these vaccines that companies like Pfizer are going to come up with, India just cannot afford those vaccines. They are coming up with, they're going to come up with fairly premium pricing for those, um, and um, and we have a huge amount of people who are not even tested for it. There's a lot of areas, not only in India, but even in the United States, where people don't have access to proper testing. There's a lot of stigma associated with COVID in India. I was in India in the last 2, 3 weeks. I was able to see the situation. Several people are cremating their family members who are dying of COVID, and not saying this very loudly to people for fear of stigma and isolation. There's a lot of larger societal issues here with this particular epidemic. So what I kind of wanted to really stress in my talk are a few things. One is beyond your books and beyond your pharmacotherapy and understanding drug-drug interactions. I think all of you need to develop an understanding of how important drugs are in the overall public, for overall public health, and what as pharmacists you can do to improve overall public health. I think one of the areas where pharmacists really have made a lot of strides here in this country, and I think now with this given COVID pandemic is going to become even more important, is the role of pharmacists in giving vaccines to patients. So I think right from childhood vaccinations to vaccines such as the HPV vaccine, which is the only vaccine we know right now which prevents a type of cancer. There is a huge role for pharmacists. We, for example, just finished a study here in the US, and our paper is being reviewed. So this recommended courses of childhood immunizations. Even in a country like the United States, we are only at averaging about 70% of the children getting the full course of the seven series childhood vaccination. So there are now rules and regulations in place in several states in the United States, which allow pharmacists to be able to administer vaccines. Many people have a lot of access issues to their physicians, especially those who live in rural areas. Getting to a doctor's clinic maybe a big issue, but most of the people in the United States live within 5 miles of a pharmacy. So the pharmacist is most of the times the most closest healthcare professional at hand for many of the patients. And I think there's a great role for pharmacists in preventive medicine and in public health. All the way from vaccinations to also management of chronic diseases, which have now become the mainstay of longer lives. So we have people who are living longer. We have people who are living longer, but again, longevity depends on sort of continuous pharmacotherapy that the patient has to undertake for long periods of time, often life. So conditions like type 2 diabetes or serious cardiovascular disease, or even conditions like HIV or cancer, which were considered like kind of deadly conditions, are no longer considered as deadly as they were. Um, just an example close to my heart is my mom was diagnosed with early stage breast cancer and underwent a preventive lumpectomy 6 months ago, and since then she has been on an aromatase inhibitor. And patients have to take this medication for five to 10 years. So once you are treated for your breast cancer, there is this extended period where the patient has to very regularly take the adjuvant hormone treatment. And taking and my studies have and studies done by myself and several other people have shown that taking these medications as directed by the physicians regularly, daily, for an extended period of time, not only prevents the recurrence of the tumor, but also prolongs survival for many of these women. But it is really, really important to take the medicines, and these medicines are not without their side effects. One of the biggest problems of adjuvant hormone treatment is the musculoskeletal side effects that a lot of women face while taking these medications. So again, we have other social issues and public health issues that come up because of that. In the United States, for example, we see an indiscriminate amount of prescribing of opioid medications to manage some of this cancer-related pain. And what happens because of that? We already have a major opioid epidemic here in the United States. We see a lot of cancer patients getting addicted to opioid treatments and stopping some of the essential life-saving treatments like the adjuvant hormone treatments, for example. There's a lot of also issues with older people getting access to opioids and then diverting those drugs to be sold on the black market and things like that. So there is this whole big complex social phenomenon around drugs, where I think there is a great role for the pharmacist. So I think the main message which I'd like to say is, right now, I mean, it's good to have the exam system and to sort of learn the Goodman Gilman and learn all that drug interactions and all that other stuff. But the bottom line is a lot of this stuff is available on the computer. It's All this information is there in our information systems. What is more important is that you guys know how to use it properly, use it at the right time, and also present it in a way that is comprehensible to the patient, that does, and like our previous speaker mentioned, does not compromise your ethics in any way. So these are things which are really important. So a lot of people ask, and I really kind of appreciate what the previous speaker said. But one of the things they say, the first question I'm usually asked whenever I come to India to give a talk or something is, oh, what can I do to get to the US, or what can I do to get to Canada? I have a PharmD from India. So I think there are huge differences in the way the students here are trained compared to the way students are trained back in India. While the emphasis of the education in India is more focused on curricular learning, and a lot of stuff related to books and what has been published. Here, for example, a lot of students are right from the beginning uh, immersed in real world pharmacy situations, where they have to counsel the patient, where they have to work with the patient, where they're to work under the supervision of a pharmacist in a hospital type of setting. So all these are a part of their training experiences. In fact, most of the students spend a whole year. Their fourth year is fully based on practicum experiences in clinical settings. as well as retail settings for those who kind of wish to go into retail pharmacy, to be able to truly comprehend the nature of the work, what it sort of entails, what standards of practices and ethics are sort of needed. um, I've spoken to several people in retail pharmacy. It's not an easy job. You have to often stand on your feet for 12 to 14 hours in a pharmacy dispensing medications. There's a lot of pharmacist burnout because of that in the United States. Um, there's also the situation now, at some point in time, it was very easy for a foreign pharmacy graduate to come here and take some equivalency exams and get a pharmacist license to practice. That has changed quite a bit. The Pharmacy Council regulations have changed quite a bit. So it's not as easy. With the growing empowerment of the pharmacist as a healthcare professional, in parallel with the doctors doing many of their work, like immunizations and as well as counseling patients on long-term use of medications, um, addressing issues like serious drug-drug interactions, and potentially being able to substitute treatments based on availability, affordability, access issues. Um, it sort of becomes really, really important that uh, pharmacists develop those type of skills where they are able to survive in any type of environment. And for this reason, I encourage all of you to do a few things, especially if you aspire to go abroad. Is first of all to work on trying to improve your communication skills. You need to be able to communicate to people in good, simple English. You need to be able to write clear, simple English. And you say, okay, I've been to an English medium school, all our education is in English, and this is all fine. That's very, very different from conversational English and communication, written communication that is practiced in countries like the United States and Canada. So if there are opportunities where you can improve your skills, you can maybe work to try to get some of your posters or something else like that published in an international journal. You should do that. ISPOR, the organization which is behind all this, offers many opportunities for students to participate in their international conferences, present papers there. They give travel grants to students. Many students here have benefited from those travel grants. I encourage all of you to apply for those travel grants, travel to these conferences and see how other people are presenting their papers, how medical things related to pharmacy, how they are professionally communicated in the media. These are really, really important skills that you sort of need to have. The other issue is maintaining professional ethics and integrity is very, very important. The previous speaker mentioned a little bit about this. You can no longer have this chalta hai type of attitude. That's not going to help you. You absolutely, I mean, everybody understands people are human and people make mistakes. Maybe one time if it happens, people will say, okay, it was a genuine mistake. But if it is a pattern that keeps repeating, then there is no scope for you. People will say there's something wrong with this person. Right now, we live in an environment where there's a lot of qualified candidates for a very few jobs that are available. So there is absolutely no scope for you to be lazy and lackadaisical about your job. Just thinking that because you have a PharmD degree or whatever degree you have, that a job is going to come and fall into your lap, I think is wishful thinking in these days. I think you have to go above and beyond. You have to make the effort. You have to learn not to be unfazed by failure, because things are not going to, the world is not going to move in the direction you want to all the time. You have to keep the struggle alive. You have to keep persisting. You have to be professional in your communications. You have to develop a network of professional people who will vouch for you and your skills. You have to keep in touch with your professors and staff members who educate you so that they can vouch for your skills down the road. These are all really, really important skills to sort of learn. And I think, given the way this pandemic has changed the way we are living our lives, I think it's really, really important that you really adopt this principle, because many of the times you may be not going into a physical workspace, whereas you may be doing all your work sort of on the web, and doing all this online. So in any type of communications like email and so on and so forth, you need to be extremely careful how you sort of like kind of like, so like I often get emails and they say, dear Rajesh, what do I do? And I said, listen, I mean, I'm not giving you permission yet to call me by my first name. I mean, until I give you permission to do that, it should always be dear Dr. Balkrishnan or dear Professor Balkrishnan. So you have to have that type of professional demeanor when you approach people. I know that we live in a world right now where things are fairly casual. But in our scenario, in the medical scenario, people still like a little bit of formality. So you have to keep um, that type of uh, professional distance when you talk to people. Everybody is not your friend or your buddy. The other thing also, like the previous speaker mentioned, is you have to be, these days, most of us live our lives through the social media, and we all have a big social media presence, and there's a lot of people who have benefited tremendously from exposure on social media. But also one of the things you sort of need to um, know is to sort of be professional in social media also. If you sort of want to talk about things like politics, or some other type of entertainment, or some other type of chalu things, keep a locked account which is only to be seen by your friends. Because I want to tell you this: we live in a world where you have a significant digital presence. Anything you put on the internet, anything you sort of is there for the whole world to see. And oftentimes employers see all this stuff. In fact, many companies here, I have students who are working for companies like Merck and so on and so forth. They have very, very strict guidelines on what you can even post in your personal Facebook accounts and things like that. So I would really, really urge you to maintain a professional demeanor at work. Of course, what you do in your social life beyond your work is your own. But social media, don't confuse social media as something that is a part of your private life. It is there for the whole world to see, and anything that you do digitally is there for the whole world to see. And oftentimes employers take a look at those type of things. If you have a gripe with your boss or something like that, don't take to social media to express your anger at your boss, even using indirect terms, because all these things are sort of seen. So basically, what I wanted to tell you is that this COVID thing has made life um, a lot more difficult, uh, and in some ways easy. But in terms of professional sort of behavior, and work in health outcomes and health, and these types of research, it's going to create more barriers, because ultimately we need data from patients. And if we are not, there's going to be a lot of patients, for example, who are very scared to come into clinics because of COVID and stuff like that. So if you're planning to collect very detailed clinical measurements from patients and so on and so forth, it may not happen at the pace you want it to in under normal circumstances. um, again, I think it's really, really important that you follow protocol in whatever you do. If there are protocols in place that you sort of need to test patients in a certain way, to obtain their informed consent in certain ways before you start collecting all this information from them, please educate yourself in all of this and don't detract from the rules. If you have any doubts, it's perfectly okay to go to your supervisor and ask them and say that, sir, I'm new, I'm in this place, I don't know what to do. Can you please advise me? So I think you really owe yourself that, and owe yourself an increased level of professionalism. I know many of you are interested in going abroad and getting jobs and stuff like that. Um, Unfortunately, I know that these type of pandemics in the world are only going to make it a little more tougher for you to sort of go abroad and do things, because everywhere people are going to be screening for people coming from outside, and sort of making sure. I mean, for example, when I came to India to visit with my mother, whom I had not seen since her cancer surgery, just 2 weeks ago, 2 3 weeks ago, I spent, even though I'd taken the COVID test, I tested negative. I had uploaded the results on the Government of India website and the Government of Maharashtra website. I still spent almost close to 3 hours in Mumbai airport before I was allowed to leave, without to do home quarantine. So again, people are on the edge. We are going to come through this. Hopefully, in the next year or two, the COVID will be downgraded to a flu-like status. That is the hope. We will have at least some type of moderately effective vaccines that will be at least effective in the most at-risk groups like the elderly and the immunocompromised. So it's not all bleak. But again, this pandemic has really changed the way we think about our lives, and I think more now so than any time else, it becomes really, really important for you to sort of let go of your chalta hai attitude and take some extra steps to be totally professionally competent, have a professional demeanor in what you do, and do everything thoroughly and methodically, as required by the protocols, and not deviate from them. So those are my words to you, and this is why I purposely did not have any slides, because every time I come to Nitty and I put up a slides about pharmacoepidemiology and all this stuff and collecting information from patients and quality of life surveys and things like that. But right now we have to take a sort of more of a real life stock of what's going on, and accordingly tailor our lives to it. So I really want to congratulate each one of you who has taken the time to enroll in this workshop, because like everything else, you'll find that these type of interactions are useful as you develop your professional skills, and it's and again, I want to say this, I say this all the time, more important than getting the gold medal and topping your PharmD exams and all these other things, is that you develop a thorough professional demeanor in your work, in the way you present yourself, in your makeup. Oftentimes I have found, like, it is very important because people look up to pharmacists more than anything else. So you have to practice health hygiene in everything you do. You have to really show the world by example that you can really you are focused your life on trying to improve the lives of others. So with that, I think I'm going to end my talk over here and take any questions from you. I would ask you not to ask questions about coming to the US and stuff like that, because I think all this has been answered before. And quite frankly, this time is not a good time to come to the US right now. Maybe next year we can talk a little bit better when things change. But we are in the worst possible situation right now with with politically as well as with the COVID and a lot of other things right now. So this is not the best time to be thinking about a life in the United States, but that could change very soon. So thank you.
Yeah, sir, thank you so much. I think that talk was a much needed talk for all our students, for all faculty, especially in a time like this where we need to put our focus on how much we know beyond the books. And I think that's something that even our previous speaker has emphasized upon. And you've not only stuck to professionalism, but you've even touched upon how moral we need to be, certain standards that we need to set. And
Hmm.
something personally that I've also been talking to all my students under me, just mentioning it here and there, that there is a standard that we as PharmD graduates need to set for the upcoming
Right.
batches. If we don't set a standard in the demeanor, in the way we walk, in the way we talk, then we can't expect people to respect our profession as well. So we want to thank you so much for sparing time with us. And we are really grateful for that encouragement, for the word of direction, and for those moral attributes that you've set, sir.
No, no, thank you very much. And I'm very approachable. You can talk to Dr. Uday Venkat. I see TM Anil on the call here as well. Hello, Anil. Nice to see you. I'm very approachable, and I am fairly alive on social media and other things. So if if there's any way I can help any of you or any of the participants, please don't hesitate to reach out to me. But again, I expect professionalism. If
Right.
you just kind of, I know that many of the students, they're scared of me because they kind of start this talk like, sir, what are you doing? Sir, I'm doing fine. And I just tell them, listen, I have no time for idle chit chat. If there's something I can help you with your professional or career, then you can talk. But
That's right.
otherwise, no time for all this just idle chit chat.
I
So
agree,
so
sir.
again, you have to practice that even in your social interactions. You have
Correct.
to be totally professional in what you do. Okay, good luck
That's
to
right,
all
sir.
of you, and thank
Thank
you
you,
for
Thank
sir.
you.
having me.
Thank you.
All right.
Thank you, Rajesh. Good evening. Or
Nice to see you, Dr. Shastri. How are you?
it's, yeah, I'm good. So nice to see you after maybe 6 months. I think 6 months back in February we met.
Yes,
So
yes, yes, yes,
the
yes.
physical interaction, and it's nice to see you again.
Same
And
here.
as you said, Uday is trying to bring people from all over the part, and it's
Right.
so. I mean, in a way, COVID has made our life a little bit easier, to talk to each other and give.
Sure.
I mean, the positive side of the negative COVID
Sure.
issues.
Definitely. Definitely.
Yeah,
Definitely.
yeah. Thanks, Rajesh. It's a
Thank you.
wonderful, this one. My students will be definitely, as you're a part of our system now. I
Oh,
mean, with
definitely. I consider
system,
myself a part of the Nitty family. So,
exactly,
yes.
exactly.
All
That's how.
right. All
Right,
right.
right.
Nice talking to all of you. All
Thank
right.
you,
Yeah,
sir.
Bye.
yeah.